work happening around mental health in the sector, or from a government point of view, Commonwealth and state, to rethink the delivery of mental health services?
Look, I mean, there's been so many reviews. I think, the one positive sign that we've had over the last, over COVID, was the increase of the Medicare subsidised psychological services. So an expansion of that is great. But there hasn't been really that many significant changes to how services are funded and delivered. Okay. And there's been so many. If we look even at the Stokes report, for example, that was from 2012, there were some absolutely fundamental things in that report that talked about how we care for people and really unwell people coming to emergency department or leaving hospital. Most of those have not been implemented. So we don't have a lack of reviews or a lack of recommendations. We have a lack of willpower and commitment to actually deliver them and make the changes. So if you look at an issue really, a burning issue in this country, which is suicide, and I don't use the word crisis very often, but if we're not in the midst of a crisis of suicide, I don't know what that means then. I don't know what it looks like, because...
So is there a number to qualify? Is that a crisis? Is there a number of suicides happening every year or month?
Well, I mean, we know suicide is the leading cause of death for men 18 to 40. Okay. And I look at that, for example, I think, well, if you said to people, what do you think is the leading cause of death for men that age? I think most people would say, traffic accidents, because it's so well publicised. We put so much time and effort into enforcing the road rules and education on road, and that's great. We should do, but there's many more men dying of suicide than what they are in traffic accidents. And if you look at the youth suicide as well, so I look at these things. I look at it and think also, these are highly preventable things. A suicide by a young person or a man 18 to 40. It's really preventable and has such a profound impact on the rest of their family and their community. And I look at the recent federal election, and mental health was not a big issue. And governments always talk about jobs and growth and these sorts of things. And what's our policy going to be on turning boats back? These are the big talking points in elections, which is really disappointing, because I would love to see suicide and youth mental health and first episode of mental health services far more important. My sense is that governments don't want to make it a key election issue because they know it's very challenging to address, and they don't want to be held to account 3 years later. And no one would want to go to an election saying we are going to eliminate or reduce youth suicide, because it's going to take more than 3 years. But I don't know that that's ever possible, but politicians like to make election commitments that they think they can meet. And this is, suicide it's really tricky, and it's difficult and it's challenging, and there's no easy solutions. But we're not going to start to solve it unless we actually put it up there as an issue that we're going to work together to solve.
Thanks for sharing on views on suicide and where it has gone bad. And just from a purpose, again, coming back to the values and the purpose of the organization, specifically yours, people who are frontline, who are engaging with, people who are going through bad phase in their life, what kind of value systems they are driven with, and why do you think purpose is important for those?
So we've got, when we do our yearly staff engagement survey, we know we get really great results from staff and their connection to our vision, our purpose and mission and values. So I go to every orientation induction we have of staff every fortnight, and I talk to the staff, and the key thing I talk about is our connection to mission and values and purpose. And I do very, very little work going around to the sites trying to inspire or motivate staff. We attract and retain people who are really motivated to make a difference. And I think the key values behind that, it's easy to say, well, our values are, we care for people, we believe in recovery. But when you actually drill down to these, I think the core values that are predominantly held by the staff, myself included, is that every single person has the right to the best quality mental health services. And what that looks like is that it doesn't matter who you are, where you were born, what language you speak, how you identify, what religion you believe in, or anything like that. You deserve the best quality mental health services that are culturally safe and appropriate and welcoming for you.